talking about coaching and psychedelics. My name is Yannick. As always, I'm here with Julia. Julia.
Hello. However you want to pronounce it.
Julia's German and we speak English, and you're living in Spain. So, I'm sure you get over.
Netherlands is also fine. So just a big mix.
My daughter grows up with 3 languages, so now it seems strangely normal for me to say things in 3 languages sometimes, just to kind of. But hey, we're here with a super exciting guest, Danielle Nova. Welcome to the podcast. It's really great to have you here.
Thank you so much. I'm honored to be here.
Yes, we have a friend in common, and who made this happen. And I'm super grateful that he mentioned you, because he mentioned you at the intersection of coaching and microdosing, and you run a super exciting training with a faculty that we had a look at. And I think between us, Julia and I probably know most of them in some way or capacity. So it's a really, really exciting thing you've been building there. Flow states were my first research academically to look into flow states, and my background in positive psychology had me really excited about, this state of engagement. And I got excited when I saw that you centering, your school around this. So lots to talk about around microdosing and coaching and facilitation and how these might meet. But just by means of introduction, if you sat at a dinner party with a bunch of coaches, let's say, you go to some event and you hang out, and a coach asks you, hey, what do you do? / who are you? Which is usually what that question is about, right? How do you introduce yourself to a coach?
Absolutely. Well, thank you so much for, inviting me onto the podcast, and especially to Stephen Huang at MAPS, who we have a friend in common. I adore Stephen. He's amazing. He's on our faculty. So I would say, I'm Danielle Nova. I have been working in the psychedelic field for over 7 years, creating educational programs and integration services for 25,000 people worldwide. I specialize in helping people with addiction. I've created a program called Psychedelic Recovery, which is a peer support education program to help people either interrupt addiction or find recovery with psychedelics. We've had over 5,000 people come through our program. And I co-founded an initiative called Decriminalize Nature Oakland. We passed the first ever resolution in the United States to decriminalize, deprioritize all entheogenic and psychedelic plants and fungi in the city of Oakland. And there's been over 15 cities, I believe, at this point that have used our same framework and passed the same initiative at the local level across the United States. And I most recently co-founded a new company called Flow State, and we created the most comprehensive, diverse, and thorough training program that exists on microdosing. We have a faculty of over 22 of the world's leading experts, psychedelic researchers, and clinicians to train our practitioners how to become microdosing facilitators and coaches. And we're really just so proud of the program that we've created. And our mission is to steward this next wave of the psychedelic movement, of professionalism, of people that are understanding what they're taking, why they're taking it, and how to use microdosing as a tool for transformation, growth, and alchemy.
Thank you for that introduction.
Yeah, you've internalized that. Wow, 5,000 people. That's well done.
With the recovery program?
Yeah. Large number. Julia, where should we start?
I would be interested. What is your target group with program? So is it coaches, or is it just everybody who's interested in microdosing? So is there a part of the program that is also like teaching how to coach with it, or is it just like about all the other things that are around microdosing?
Yes, the whole program is focused on training practitioners, people. We have all different types of people that enter our program. This is the second cohort we've had. In our first cohort, we've had 55 practitioners go through our program, many of which are licensed professionals, therapists, doctors, nurse practitioners, but we also welcome people that are brand new to the psychedelic field that are wanting to enter in the field as a profession. So we're training people to be microdosing coaches. And the program, it has different dimensions to it. One of it's like more of the theory and understanding how microdosing works from both the clinical aspect. We have Dr. Connor Murray, who he created the first ever LSD microdosing study in the United States. And there's only one research study that's actually studying it clinically in the US. And so he talks about the science of microdosing. Dr. Manesh Gurn at UCSF talks about psilocybin on the brain, how it works on the brain. Then we have Hyphae Labs, Reggie Harris, they created the first ever psilocybin testing lab that's actually testing real psilocybin containing mushrooms. And they've discovered which psilocybin mushrooms are more suitable for microdosing versus macrodosing. So we're really training people, how ultimately it's an integration program, because our practitioners are not there with their clients necessarily when they're taking the dose. They're not trip sitting, but they're helping them both with how to use the microdosing safely, all the different aspects of harm reduction, from dosing to understanding medication contraindications and screening out potential high risk populations of people that are coming to microdosing, to actually how to use it to reach their goals. There's millions of reasons why people are coming to microdosing, from trying to interrupt addiction or wean off of psychiatric drugs to people that are just wanting to feel well and enjoy their lives or expand and grow, even for creativity and endurance. We have a professional athlete that's going to be teaching about athletics and microdosing, and also TBI, how microdosing is going to be a gold standard, I believe, in traumatic brain injury treatment. So we've covered, the reason why we have so many different teachers in this program is because there's so many different areas and aspects of microdosing and different populations of people that can be suitable for it, that we want to train practitioners to really feel like they're experts in microdosing, that they feel resourced with all the information. We have a practicum as well, where they get to practice their coaching techniques and facilitation techniques with microdosing. And then we also have a 140-page training manual, which trains our practitioners how to actually guide their sessions from day one to day done. So they have a framework and standardization of practices that they can follow.
Before we go a little bit deeper into that, I'd love to take a few steps back and just kind of define the landscape, right? Can we talk about microdosing a bit? And then maybe let's start with coaching. What's your take on coaching? Are you a coach yourself? Have you come in through that route? Or how do you, as a school perhaps, put a frame around what coaching is?
Absolutely. Yeah, I've been working as a psychedelic integration and addiction recovery coach for the past 6 years, working one-on-one with hundreds of clients around the world. And to me, I believe a coach is an individual that guides their client home to themselves and guides their client home to their power, and really teaching people how to access that empowerment from within and the ability to help people learn how to heal themselves without creating dependency on another individual. And my mission has really been to help millions of people around the world heal from the exact same issues that I went through, and to become the person that I wish I had once I was going through all the suffering that I was going through in my life.
Yeah. When you say guide, what do you mean? Because usually when people hear guide, they think like, oh, here's somebody who's going to take me by the hand. They know the landscape, they know the area, they know where to go. They can guide me through this, right? Offering help along the way, but generally leading. And I know that's not the way that a lot of coaches understand the word guide when they say guide. So I'm just curious about your understanding of your role as a coach.
My role, I love that you said that, I think my role is guiding people back to what they desire and back to believing in themselves. The majority of people that I've worked with in my life don't feel empowered in their own lives. They don't feel empowered to make their own decisions, especially people that have been through addiction are taught that the rehab has the answer, that the doctor has the answer, that it's the next medication, that the old framework of total abstinence is the answer, and it has nothing to do with what they believe and what they want for themselves. And I believe that the client has to be in the driver's seat. And my role is bringing them home to trusting themselves to be in the driver's seat, trusting themselves that they know what's best for them, and really invoking sovereignty and being that beacon of light for them to remind them of who they are, who they've always been. And a lot of people have gotten lost. I know I got lost for a really long time. And it took a long time for me to learn how to trust myself. And that's the role of the guide, is empowering people with the resources and the trust in themselves that they know what's best for themselves, and holding them accountable in what they desire for themselves.
And how do you do that? Is there a methodology you're following, or is there a particular process that you've learned or that you teach? Or is it just different depending on who steps foot in the door, and it's all quite intuitive? How might we imagine the way that you guide?
Yeah. So a big population of individuals that I guide are people that are experiencing addiction or people that are coming off of psychiatric drugs. And the first step is the desire for change. If an individual does not have the desire for change, it's not going to work. And I am interested in the role that psychedelics can play into helping people become more motivated to change, but that's the first ingredient. The second ingredient is that it has to come from the individual, not anyone outside of them. I've worked with a lot of families that have come to me wanting to intervene. You know, there's the classic show Intervention, where the whole family gets around the person and they kind of coerce them into getting well. And I don't think that interventions work. I'm more interested in intervention, in inside intervention, where the individual is calling themselves into deeper healing and really feeling ready to do whatever it takes to heal. And then after the person is committing that they're ready to change, then boundaries are super important. I train practitioners to have boundaries with their clients of things that you will tolerate and things that you won't tolerate, such as, I won't tolerate lying, and I won't tolerate someone that's not willing to put in work, someone that's not open. And that's really important for me with my clients, that they're open to changing and open to trying new things and open to doing work and being a participant in the process. That's super important. And after that, then allowing them to start to vision what their life is, what they want it to be like. Who do they want to become? How would they want to live? And if someone's going through a deep process of addiction, I actually invite them into loving their addiction. If addiction is a choice, and it's sometimes conscious or unconscious. And I invite people to literally say they're addicted to drugs, putting their drugs on the altar and thanking their drugs every day, thanking their drugs for saving their life. Addiction is an attempt to save someone's life. And people can do that with suffering or depression, like thanking themselves that they got themselves into the situation. I don't think shaming ourselves or wanting to, take it away or pull it out of us is the approach, is really like giving gratitude for the suffering. And that might be hard for people to hear when they're in it, because they're like, well, this is hurting me.
It's hard for me to hear now.
I'm sure. Yeah. But for me, it's like, I'm here to shift the paradigm of how we view suffering. I think suffering is the portal to the purpose. I'm so grateful for my addiction because it brought me to this moment with you two on this podcast and everything that I get to do. And if I were to go back, I would just thank my addiction, for where it brought me. It brought me to my knees. It brought me to be the healthiest person possible. And I think the shame around addiction, this shame around suffering, perpetuates it and fuels it. So, really bringing that same intentionality into active addiction as someone were to bring into their their medicinal use with psychedelics. And then slowly helping people evolve into the individuals that they want to become, and realizing that there's, relapse is important. If people relapse, it's an important part of the process, because it's like a rubber band. Sometimes we need to pull backwards in order to go forwards. Helping people reach goals that they feel like are accessible to them. And, for a lot of people that have been on psychiatric drugs for a really long time, they can't even imagine what life is like to be off of them. They can't even imagine life beyond addiction. So maybe it's just what would life be like if you took 2 sips less of your alcohol today. So, I think it's really important as a coach to meet someone where they're at and recognize, especially people that have been through really deep trauma, it's hard for them to even envision their life beyond something, or even understand what's at the root of it, of what's fueling it. And then asking your client, like, what are you gaining from this? Because if the addiction didn't work, they wouldn't do it. So there's something that they're gaining. Maybe it's love, maybe it's connection, maybe it's safety.
Oh, the pain is gone for some time.
Yeah, exactly. And so just bringing more consciousness to what's happening, I think, is really important, and helping people realize that they're creating the whole thing, that it's, they're creating the whole thing, and that they have the keys to unlock all of it. So that's the framework.
Do you work with like specific tools like IFS, or like Yannick is an existential coach? So do you have like a basis framework from where you start from, what you learned, or is it just like whatever you learned, you brought it together and you do it intuitively now?
Yeah, my training program was 15 years of drug addiction. I was addicted to drugs for 15 years, and I went to rehab 8 times and was prescribed hundreds of medications. I was addicted to Oxycontin and heroin and cocaine, and dabbled in methamphetamine and, suicide attempt. And
how can you dabble in methamphetamine? I mean, we don't need to get into it, but it just seems like a weird way of putting it.
I get addiction. I understand it. And I draw from my experiencing it, and my experience crawling my way out of it. And that's all the training that I had, was being in recovery for 8 years and working on myself to heal myself from addiction. And I feel like that I couldn't have, gone to school for that necessarily, of understanding the pain of what it means to lose everything, from addiction to just the deep withdrawal and suffering that I experienced. I draw all of my guidance with others on that deep lived experience.
I think a lot of accredited coaches, they cannot train that, right? That's not something that somebody would invest in, having that experience. And I think based on that kind of experience, you really connect with people who are going through this experience right now, even though your experience of addiction is probably unique and different from other people's experience of addiction. But there's certainly patterns and themes that connected, which I think really help coaches. In some ways, I think they might also be in the way, because we might make assumptions about what your experience is like. I mean, not after you worked with so many people as you have. But have you considered doing any kind of formal coach training, or adding that kind of skill set? As but coaching has been defined in so many different ways, right? It's such a broad umbrella term. But have you ever considered adding that skill set?
Of taking other training programs to...
Yeah, like learning coaching methodologies, or doing some sort of formal coach training, or, going through a whatever, existential positive psychology, solution focused, CBT, ICF accredited, whatever. Have you ever considered that kind of route?
Absolutely. Yeah.
And what made you not do that?
Just living and doing my purpose on this planet, working 40 hours a week on my projects, and feeling seeing success with my clients, and I see tremendous value in learning with other people and learning other amazing modalities. Absolutely. I think it's just hasn't been a focus at this moment.
Yeah. I'm not criticizing, by the way, right? We speak to so many people who come into coaching through so many different routes, right? But I'm always curious because there's a disproportionate amount of coaches in the psychedelic field that have not gone through any formal coach training. They come in with their experience, and they come in with, loving people, holding space, this genuine desire to help and support people. But I also know what coaching methodologies and frameworks can add to somebody's journey. So that's why I'm always curious, because we know it's not needed to help people well, but also it's a set of tools that has been explored at depth, and there's good amount of research, and so many people study how can we most effectively hold space for people through various coaching methodologies. That's why I'm curious.
Absolutely. I think there's a lot of value in programs.
Well, you would know, right?
Yeah, absolutely.
Julia, can I throw one more in, or do you have one burning?
Do
Yeah.
it.
Danielle, you mentioned healing, and which makes a lot of sense given what you've just described, what your journey was, and the kind of journey that you help people. A conversation that we often have with coaches, and particularly again in the psychedelic intersection, is, well, where does coaching stop and therapy begin? And whenever somebody says healing, I'm like, well, coaching, as far as I understand it, is not really about healing. Coaching can be healing, right? But when somebody comes into coaching, particularly to help people heal, the therapy lights go on potentially, right? Depending on how you relate to it. So I'm curious about where your threshold is, after which you believe that maybe this is no longer coaching. Maybe it doesn't matter to you because in your practice you have so much to offer. But when you train people, maybe that's a better kind of lens to look at it, right? When you train people and they say, well, I want to help people heal from addiction. At what point do you say this is no longer facilitation or coaching? I think this requires therapy.
Yeah, I think it's, we really train people to understand their own individual capacity. And I believe that we can only help people as much as we've helped ourselves. And we have, like I mentioned earlier, we have all different types of practitioners in the program. We train people to understand if they're getting triggered in a certain area with a client. Maybe that's a time to refer out. If they feel under-resourced to be able to help someone with something, that's a time to refer out. I think it's really important, as being in integrity as a practitioner, to understand where your limitations are. And I'm more curious in that aspect, of like, I've personally worked with coaches that have gone through extensive training and they wasted my time for years because they didn't actually know how to help me. And I think that it's important that we train people just to really be in integrity with what they feel like they can actually help individuals with. And, I don't want to waste anyone's time, and I don't want people to have their time wasted. So it's, their time is sacred. People are coming to people in vulnerable positions. And the beauty in our program is now we have so many different practitioners with all different expertises. So that's really exciting because I have people to refer out to, and people that, we really empower people to understand what their niche is. Who do you feel most empowered to support? And when is it where the point to which you feel like you can't help someone? Is that within sexual trauma? Is that within, certain populations of people? So really allowing the practitioner to understand where their limitations are within their expertise, I think, is really important. And we teach refer. If there's any point where you don't feel confident in your abilities, that I think that's the time to refer out.
And do you think that there are like different substances that are good for different problems, challenges. So do you only focus on psilocybin in the microdosing training, or is it also like other different substances that you work with as a microdosing coach or trainer?
So we, at the centerpiece of our training is psilocybin and LSD microdosing. Psilocybin is the most widely used substance for microdosing. We do cover ayahuasca microdosing, kanna microdosing. We have a class that talks about the history of all different types of substances that have been microdosed, from iboga to coffee to coca leaf. Animals were the first ancestors to microdose. We learned all about our psychedelic use from animals, and so we cover a lot of these other substances in that context. But the real training around application of use is within LSD and psilocybin microdosing.
Mm-hmm.
You said, and I heard this from a couple of our guests, that and coaches in general, right? That you can only help someone go as far as you have gone yourself. Would you say that somebody who hasn't had personal experience in addiction, for example, is not really well suited to help somebody who's going through addiction or currently, challenged?
I think there's a lot of practitioners that would absolutely be able to help people with addiction without necessarily having gone through it.
So how do we distinguish that, right? Because in one of the most common answers when I ask people on this podcast, what's your advice for someone who's just getting into it? In some way or another, they say, have your own psychedelic experiences, right? Because of this notion of you can't help somebody further than you have gone yourself. And given that all these journeys are so unique and everybody is so different, right? We all have our individual differences and unique perspectives, and substances affect us in different ways, and we come with different histories and backgrounds and experiences. One thing that I always loved about coaching is that I don't need to have experienced what that person has experienced. And in many ways, it actually helps me to not have any clue what they're talking about, because I ask much cleaner questions, right? The kind of 4-year-old perspectives. So many coaches work so hard to get into this state of not knowing. And there's another set of coaches that really leans into their expertise and their own experience and their own background and their own teachings and their own wisdom, right? So I know they're both just different approaches to helping people. But I wonder what you think about that. And when you teach, like, do you teach knowledge and wisdom and how to apply that, or how to bring in your experience? Is there, because when you just hold space for people to find their own answers, then you don't need to know. You don't need to have experienced any of it. And yet it often does help to have an understanding of the landscape or having had similar experiences.
Mm-hmm.
So I hear you leaning on one side in some ways, but I also hear glimpses of like, oh no, I hold space and the client leads, right? So I'm trying to make sense of that, I guess.
Yeah, absolutely. It's multidimensional, and and within my program, I teach it's going to be 4-hour class at this point, but it's a multiple hour session to train practitioners how to guide their clients out of addiction and off of psychiatric drugs. And I basically use everything that I've learned in my process to train practitioners how to help their clients if they choose to have, clients that are going through addiction, or people that are coming off of psychiatric drugs. And I think at its core, if most human beings have experienced darkness, and especially human beings that want to become a practitioner or a guide, they've overcome something within themselves that has empowered them to be able to, with the confidence that they want to help other people, and the humility that they can. And addiction's not really that different from other states of consciousness. It's like a pacifier. We've all probably had pacifiers as babies, and so I don't necessarily think someone that has to experience addiction to understand it, but we can understand, most human beings suppress ourselves to some capacity, don't want to face certain parts of ourselves, and are running from some parts of ourselves, or trying to attempt to save and support ourselves. So I think, as a practitioner, if you feel equipped to be able to guide someone through that process with an understanding of how to do so, you don't necessarily have to have experienced it. I feel like for myself, because most of my training, beyond working with Indigenous peoples and collaborating with Indigenous tribes and a lot of ceremonial work, has been drawn from my own personal experience, I feel driven to help people from that own personal experience. I know there's a lot of practitioners in our program, and they're drawing from 30 years of training and, therapeutic training and all different types of clinical training. So they don't necessarily have had to go through addiction to be really equipped to be able to help their patients and their clients. And then in terms of, sharing personal experiences, what we train about is asking the client for consent first. Like, are you curious to hear what I've experienced there? I know for myself, I've experienced a lot of coaching sessions where the coach made it all about them and was all about their own experience. And that actually felt really difficult for me as a client. And so really making sure that the client is consenting to wanting to know what the coach has been through in their life, if the coach feels called to share that. And I know that different practitioners have different boundaries around that, but only using their own experience if it's in service to the client, and not make.
Sorry, can I jump in there? How do you do that in practice? Because I can't quite imagine anyone saying no if a coach would say, "Hey, would you like to hear something about my experience?" Is there, like, how do you phrase the question so that it's not an automatic yes? Because, it would probably for most clients feel a bit awkward to say, "Oh, no, I don't care about your experience."
Well, I mean, I think it's better to ask someone for consent than not. So, what I say to my clients is, I've experienced that personally. Are you curious to hear what I experienced, to share
But
that?
who would say no? Has anybody ever said no?
Have I had anyone say no? No, I haven't. But have you ever?
I'd be surprised, right?
Well, I mean, I've never had a practitioner ask me for consent to share about their lives, so I think that's important.
I do think absolutely it's important, and there's such an elegant way to ask for permission, right? It can be done in an awkward way, but if it's done well, it just flows, and it's a really good thing to do because your client is invited, right? But with these kind of questions, right? I just feel there isn't really a way to say no when somebody offers. They might as well not ask for consent, because if you ask for consent, yes, it's always better than not. But if somebody says, "Hey, would you like to hear what I have to say?" I just can't quite see a way for the client to say, "No, I'd rather not," or "This is not really that important to me." Because in this way, it's kind of a leading question, right? The practitioner still kind of inserts their experience into it.
I mean, I feel like it's been really helpful to get feedback from my clients around consent around that. I've had clients say, "Well, I always find it helpful to hear about your personal experience, and I want to hear more of that from you."
Yeah.
And
most clients do, yeah.
I don't generally lead with talking about myself with the client session. So, and teaching people that their no is sacred and that they can say no, and that their no and of not wanting to hear information is not going to be taken personally at all. And that's also something that I, teach people in my sessions, because a lot of them don't feel like they have accountability, and they don't feel like they have sovereignty to make their own decisions, and that their no is not sacred. And, that's part of why I talked about having the boundaries setting, and really teaching people that they can say no, and that they can be in their own boundary.
especially in the context of addiction, that know has such deep value.
Yeah.
Julia, anything else in there? Otherwise, maybe we move into microdosing. What do you think?
Yeah, I'm curious about microdosing. I had the question in my head, when or how did you realize that coaching and microdosing could be a good fit? Was it like you got to know microdosing and you thought like this needs some coaching at the side to make it a fruitful process? Or was it more the other way around? Like coaching, you had experience in coaching and then you realized that maybe adding microdosing could be a good fit? Or is it something totally different? So how did you come about that crossing idea of combining it and starting this institute or starting this training?
Absolutely. So my business partner, Adam, and I created 2 educational courses on microdosing over the past 5 years. We've had thousands of people take our courses, and they were just courses to teach people how to microdose on their own. And many people that came through our courses are all different types of practitioners saying, well, how do I actually work with microdosing with our clients? And Adam and I had been both personally working one-on-one with people as microdosing coaches. People would come to us and say, I want to microdose, but how do I do this? And, developing that framework for people is just something that people were coming to me for. And I felt empowered to help them with based on both the courses that I developed, but also the work that I'd done on myself. And I think the spirit world called me in, the mushrooms called me into this. And I see there's a lot of value in combining coaching with microdosing. Some people only need a couple sessions and then they're on their way, where other people need more holding and more of a process around it. So it's different in that way, I think, from other types of modalities. And people get better too, fast. There's a lot of success quickly with microdosing. So that's been really amazing to witness with the people that I've worked with.
Yeah, it's been so cool to see all the first anecdotes and stories of people who started microdosing. I know James Fadiman was a mentor of yours, just reading into his experiences with it, what people have told him. And then some research started to emerge. Most of it not double-blind research, but it's very difficult to study something that is, well, subperceptual, I guess you could say, but like such a small dose that you wouldn't have the usual experiences that are associated with psychedelic experiences. I mean, something is happening, but also it's difficult to say what it is and whether the microdosing really caused it. And how do you know that this works other than your own experience? Do you rely on the research? Do you teach the research? Do we have good research now? Because I think are there double-blind experiments now? Because last time I checked, they were still kind of on the way, or I think there were 2 or 3 major studies in the works, and there were some preliminary findings that were really exciting. But my state of psychedelic microdosing research still is in the category we don't really know, but we know that a lot of people find it really helpful, but we don't know whether that's placebo or not. So what's the current state of research, or what is included in the foundation of what you teach?
Absolutely. Well, it's exciting times because the placebo theory has been debunked by Dr. Connor Murray. There's clinical proof that there is brain nootropic growth factor when individuals microdose. So we now know that it's not a placebo. There's limited research because in the US, there's been a prohibition around the participants taking home the medicine. They have to be in the actual clinic to take the medicine, which kind of defeats the whole purpose of microdosing. So we know that microdosing is taken on our own. And so there's only been one clinical research study by Dr. Connor Murray, and he's been studying LSD microdosing. So I'm excited towards more clinical research that's going to come out and be open for based on Dr. Connor Murray's work. There's been a lot of different surveys that he's done within microdosing. And there's been, all different surveys from menopause to also the global psychedelic survey surveyed thousands of people. And, that is IBF approved. So it is taken as research, but clinically speaking, the clinical research has been really limited because of the prohibition on the participants taking home the medicine. There's not as much interest in the microdosing research currently, but Dr. Connor Murray and Dr. Jim Fadiman believe that someday the microdose will actually be the traditional dose and will be viewing as larger doses as overdosing of psychedelics. So I'm excited for the research to continue. We're working with Dr. Connor Murray to do a research study where we're having a retreat. It's a microdosing research retreat where people will come, and he developed these headbands that are EEG headbands that actually scan your brain as you microdose to understand the impact that the microdose has on the brain. So we're really looking forward to helping further the research of citizen science research, which is just as important as the clinical research. Because a lot of the clinical research that's currently being done is testing psilocybin, which, is synthetic psilocybin, and people are not using synthetic psilocybin. They're using real psychedelic mushrooms, and there's all different contexts and backgrounds and ways that people are using these medicines. So I really appreciate that Dr. Connor Murray is both pioneering clinical research as well as the citizen science research with these headbands that he developed.
Yeah, that is super exciting because that's really what we want to capture, right? Are you familiar with that? You said that there's one particular study. Are you familiar with the details? Can you tell us a bit more about who was that with? How many people were there? What did they experience? What was measured? What were some of the outcomes?
I couldn't tell you like the exact number of people or individuals. I'd have to send you the research study. But if you look up Dr. Connor Murray, UCLA LSD microdosing research study, it's been amazing that they actually found that there's brain nootropic growth factor from the microdose.
Yeah. So brain nootropic growth, probably in the title, or do you remember then the year it was published so people can look it up?
I'd be happy to provide it to you in the show notes.
Yeah, fantastic. Okay, then we can definitely just share a link, and that I know there's some people in this audience who really are on the academic side of things, and they're like, oh, I want to look up the evidence. Cool.
And I think there was always like mentioned regarding microdosing that if you do it too long, that it could be bad for your heart. So I don't know if that's still a rumor or if it was really in the research, or if there also is now other outcomes and information about it. Because I thought that it's like you can microdose for a certain while and then you have to stop. And one of the reasons is like for your heart. And I think it was especially in combination with psilocybin, but not really like they weren't sure if it's really like that. But to make it sure that you don't get sick, you should stop for a while in between. Do you know something about the current research about that?
Yeah, the current research is very limited. We're definitely at our infancy phase of our understanding around microdosing and its risks, especially long-term risks, given that clinical research, even for psychiatric drugs, most psychiatric drugs are prescribed for years at a time, but the longest any research study is 6 months at a time. And there's no long-term follow-up on any type of drug, or a lot of studies aren't testing these drugs in combination with each other. I do know that the valvular heart disease risk was a hypothesis based on a medication working on similar receptors. And there was a hypothesis that there might be a high risk of microdosing with that. There just hasn't been anyone that specifically studied that specifically yet. I know that from the researchers we've spoken to, there isn't any focus of the research specifically on that. They didn't seem that concerned with that being a risk. Dr. Connor Murray, who's really the leading microdosing researcher in the world, says microdosing is as safe as a cup of coffee. And, he really believes that this is safe, but that's why we train people to take days off, to follow protocols, to take months off at a time, because we just don't know. We don't know what the long-term effects are with microdosing, and maybe everything that I'm saying here will be completely debunked as the research grows. So I just want to give that disclaimer that we're really at our infancy phase of our understanding.
Sure.
I know Jim's protocol, Fadiman's protocol of 2 days on, 1 day off. Is that still going, or what kind of protocols do you teach?
Yes, the
And are they
Fadiman
different
protocol.
when you coach versus when just people are to take it home? Are there different protocols for different outcome, desires, goals, etc.?
Absolutely. So there's, the Fadiman protocol is very much alive and well. The most commonly used protocol that people are following specifically for psilocybin microdosing is 4 days on, 3 days off. Some people follow 5 days on, 3 days off. What we train about is it really depends on the substance, the person, and what they're going through. Like, for example, if someone is using psychedelics, using microdosing to help them wean off of a psychiatric drug or to interrupt addiction, they'll probably be using a more frequent protocol than someone that's a healthy normal and just interested in microdosing for growth and spiritual development or creativity. And it also depends on how the microdose impacts a person. We think it's really important for the person to decide which protocol works best for their life. Like, some people find microdosing to be helpful for their work, where other people can't work when they microdose. So that would also impact the protocol that they're using. And maybe they're just going to microdose on their days off. So we know we train about 4 to 5 different protocols, from every other day to 4 days on, 3 days off, to Fadiman's protocol of every third day, to the intuitive protocol of really, teaching people to decide when they want to microdose and when they want to take days off.
How do you know intuitively, like what to look out for in your experience that tells you today is the day, or how would that work?
I love that question. We train people to develop the relationship with the medicine, because we're welcoming in another consciousness into our body with psychedelics. It's not just about the individual with their coach. There's multiple different relationships happening. It's the individual with their medicine. What is their relationship with the medicine? The medicine will actually speak to people and communicate to people, and they can have a reciprocal relationship of conversation, of reciprocity, of guidance. And then there's the spirit world. Some people feel like microdosing opens them up to more of a spiritual awareness. So there's a lot of different relationships happening within this dynamic. And I teach people to talk to the medicine and communicate with it and ask the medicine, should I be microdosing right now? Is now the time? And I've never heard anyone say that they don't get an answer. They
Really?
always feel like there's a communication with the medicine. So
what forms does that communication take? I mean, I'm just putting myself into the shoes of somebody listening to this who might not be so connected to the spiritual perspective of this, and they might like, what do you mean you teach people to talk to the medicine and you're inviting another consciousness into yours? Just for someone with a more kind of material perspective, how might they imagine a response, or how might they imagine that kind of dialogue?
it can come in as thoughts of our own that we feel like are our thoughts. It can come in through actual conversation with the consciousness of the medicine, through even an experience on the medicine. For example, if I microdosed and so many emotions came up for me and it was just very overwhelming for me, I might feel like, am I resourced to handle that? And maybe the medicine is showing me that I need to take a break and not approach microdosing right now because I don't feel resourced to work with my emotions. And I've literally had experiences where the medicine said stop very directly. And clients have experienced that as well. Or the medicine just doesn't work. And that's been a very common experience for people where they had a lot of benefit from microdosing, and then all of a sudden the medicine just stopped. And to me, we don't have a scientific explanation for that besides a spiritual explanation as the medicines that we're ending our relationship right now. Maybe it's the medicine not being helpful and actually being, deterring someone off their path. I know for me with psilocybin microdosing, it was really helping me at one point, and then it wasn't. And that was the medicine communicating to me that I was done. So understanding the nuance of the ways that it might be communicating, I think is important for people to learn.
Yeah, I
And I
really
think it's very
appreciate your
important
perspective.
that you mentioned that. Yes. Yeah. Because I'm also on that side, and I think like how important it is that there's a lot of research and that it goes in direction of medical perspectives on it and how to use psychedelics and everything. But for me, oftentimes the mystic side, the spiritual side, is lost in this scientific part. And if you look at research, it's oftentimes the mystic part that makes the change. And I think it's so important to teach people this, like being in connection with what you are taking, and not only psychedelics, but being aware of what you are taking in and being with what you're taking in and having that connection to really discern what is good for you and what not. And I think that's very important that you teach people that. So thank you for doing that.
It's the same thing in coaching, right? How many times have I seen it in one of our coaching labs that a coach asks a question or comes up with an intervention or shares something that is totally not textbook coaching. It's just so off. And when we ask them about it, it's like, where did that come from? And sometimes they don't know where that came from, but they have learned to create this relationship with themselves, their intuition, their experience, and being in a relational space with someone that they experience has taught them that they can trust that. Right. So even if you ask a question or you offer a piece of guidance where maybe your coaching stool told you not to guide in that way or not to teach, or making a suggestion or even urging someone to do something, if that feels right in that moment, you just bring in that relationship with yourself. Coaching as an art form, not just as a set of skills and methodology.
Mm-hmm. Exactly. I love how you say it's an art form.
Yeah, part art, part skills, right?
Mm-hmm.
So I'd be so curious to invite listener questions at this point. I wonder where people are at. Where do we go next? I wonder.
I'm wondering about the legal side, because I mean, it's everywhere, it's very different. I know in Holland there's also a microdosing institute. I know people from Germany who are microdosing coaches, and it is so different in different parts of the world. And especially in the US, you have different counties, parts that are where psilocybin now is legal and you can buy it, and other parts is totally prohibited. So what is your take on that, and how maybe do you work with the legal question in what you do?
Absolutely. So we have a lawyer that is on our staff, and we teach a 2-hour legal session to help our practitioners understand the evolving legal landscape of microdosing and psychedelics. Currently, we are still federally going through a prohibition where, federally speaking, psychedelics are illegal across the US. Decriminalized Nature, the organization I was co-founder of, that has passed at the local level in cities all across the US, but it doesn't really change the statewide initiative or federally speaking. So within the local level where cities have decriminalized, it's actually deprioritized, meaning they can gather, grow, and gift the medicine, but they can't commodify it or sell it. There's a lot of psychedelic churches, hundreds of psychedelic churches that are popping up, that are claiming the legal right to be able to use psychedelics as a sacrament. Many of these churches are selling the sacrament under the church, in decriminalized areas, but that's sort of this loophole that's being created. And then Oregon has legalized psilocybin therapy, as well as Colorado has passed a legal initiative, and they're working on building that program for launch. So there's 2 statewide legal initiatives that have passed, and there's a lot of different initiatives that are working to change, like in New York. I know that they're trying to create a more of like a licensing program. And Oregon and in Colorado, there's licensing. In Oregon specifically, a lot of practitioners have gotten trained and gotten licensed. There's now psilocybin service centers where you can go and have an experience and completely legal experience. I know there's a lot of tourism that's coming up and happening within Oregon. So I think other states like California are looking towards what's going on in Oregon, what's going on in Colorado, what's working, what's not working. I've worked with a group that was working alongside Governor Newsom. There's been initiatives in California that did not pass for decriminalization. And from my understanding, I don't think decriminalization is going to happen in California, which is really, really too bad. I think decriminalization should just be basic framework for what we're doing. I don't think anyone should be arrested for gathering, growing, or gifting the medicine. I don't think we should have to go to prison for something that's literally grows in my backyard. I think, ultimately it'd be really great for psychedelics to be treated like fruits and vegetables, where you can grow your own blueberries, and there's blueberries that are sold in Whole Foods, but then there's blueberries that are sold at the farmer's market, and there's all different, blueberry growers. But I think we're going to see different frameworks for psychedelics come out.
Yeah, it seems logical that this is a matter of time, because it's really quite stupid. Not across the board, but in general. Coaches, right? I know some coaches ask themselves the question of, well, if I'm helping somebody integrate an experience, that cannot possibly be illegal, right? Because I'm having a conversation. I have nothing to do with the medicine. They've done a session somewhere, or they went into the woods with their friends and they had a bad or a good experience, or whatever they're trying to integrate into how they live their life now, that something seems to have shifted or something has challenged them. That can't possibly be illegal. When somebody approaches them and says, hey, I'm planning to do this, that's a different story, because I know some coaches are concerned that maybe they're now colluding with someone who might involve in something illegal or something dangerous or something potentially risky. And I know at microdosing level, it's a very different story because there's very different risk involved. But legally speaking, there's no difference between a high dose and a microdose, right? So have you got insights from your lawyer or from yourself in terms of coaches' concerns about possibly getting themselves involved in somebody else's illegal activity?
Yeah, it's a great question. And we look at it as more of harm reduction. I think it's causing more harm to not guide someone in the preparation than to guide someone in the preparation, to not give them any kind of guidance on set and setting and dosing and proper use and medication contraindications. I think that's actually more helpful than turning a blind eye. And that's really the whole purpose of our program. Is right now, if you were to go to your doctor and say, I want to use psychedelics, most doctors will say, I don't know anything about that, and I don't know how to help you. And if you had a challenge come up about it, they might say, a lot of times they've said, go 5150, or, you're going crazy or something like that. That's happened to a lot of people. And so I think it's important for people to become psychedelically informed. And it doesn't mean that they're telling people to go use something illegal. It's just saying, okay, if you decided on your own that you want to use that substance, this is how you can stay safe. And it's kind of like practicing safe sex. It's very similar. Your provider is not telling you to go have sex. They're saying this is how you can do it safely. And I think that is more ethical than not. And, we teach that to not provide the substance to people, to not tell them where to get it, but you can provide everything else to really keep your community safe.
I think that's part of the argument that some people would have, like, oh, don't teach my kids about sex, because you're kind of normalizing that that's a thing, and you're making it seem okay, and I know there's lots of debate around, especially in the US, about like taking certain books out of libraries or taking certain topics out of the curriculum, because people are seeing this as part of promoting the practice. And you can use that same argument. Obviously, I'm playing devil's advocate here, but I guess you could use that same argument when it comes to even harm reduction. So legally, does it still hold up, the harm reduction argument?
That's what we've been trained on. That, yeah, I don't think the lawyer would have joined our program if they didn't support what we're doing as a means of harm reduction. So I think we're providing a public service through education. I think education is more important than no education at all. And that's really how we change the laws is a lot of the laws happened because of challenging experiences and stigma, or at least that's what we were told happened. And I think we can change the world and change the laws by creating a psychedelically informed public. We can reduce negative experiences from happening the more people understand how to properly work with these substances.
Yeah. I'm smiling because I can feel the activist in you, and you clearly have done so much work in pushing these initiatives forward. And thank you so much. But I know a lot of coaches really needed to hear that. And maybe it allows more people to offer a space where people can understand more and, work to reduce harm and send people into experiences with more knowledge. There is, however, I think there's a threshold somewhere between putting information on the table, providing knowledge, versus the kind of guidance that is directing people towards certain experiences, right? So do you know what I mean? Like at some point, there's a threshold after which I take a lot of responsibility with the information I put on the table. And especially, I mean, with microdosing, I'm much less worried about that. When it comes to high dose experiences, I'm hesitant to put certain information on the table because I can't be confident that this is good information. Like you said earlier, right? The science is still developing, and what we know is still developing. I think it's probably still better to have some information on the table and an understanding that the client needs to grapple with that, also do their own research, not just take everything I say for granted and as truth. But I also know in reality, a lot of clients, they will approach a coach, especially someone with expertise. And then when that person with expertise says something or puts something on the table, regardless of how careful they're phrasing it, they're not going to do their own research. They're just going to take what you say because they feel that's what they're paying you for. How do you carry that kind of responsibility when you work with people?
It's a big responsibility. It's a big responsibility. I think empowering people first of all, I will never provide education to someone that doesn't want it. I'm not here to try to convince them to believe in psychedelics. I only want to speak to people that are open to receiving this information. That's really important for me. Mm-hmm. And, putting out the information that this is an individual's birthright and choice to decide what they put in their body, and really laying out the risks and the benefits, both equally. And that's the most that we can do, and understanding the limitations of where the research currently is, what we do know, and where there's a lot of question marks. Yeah. And also screening out. Mm-hmm. Just screening out, there's certain populations of people that probably aren't suitable for psychedelics or microdosing, and making sure people understand the potential risks there.
Oh yeah, this is great. Screening is always on our list. What is the process of screening? And I mean, for those people not familiar with the term, like, what do you do to, like, there's a set of questions that you ask. Is there tools that you work with? I know some coaches, they refer out to psychiatrists to do some screening. What we're trying to understand is this person a good match for psychedelics? And again, probably more important with high doses, with low doses, but there still is. What would you screen out, and what's your process? I guess is my question.
Yeah. So we have a whole intake form, and this intake form was developed in collaboration with our different teachers, one of them being Ben Malcolm, who's a clinical pharmacist, and he's pretty much the only expert in the world right now that truly understands.
That's Sherry's partner, no?
Yes, exactly.
Yeah.
Have you had him on the podcast?
No, not yet, because
he was my teacher.
He was?
He's a teacher of our program, so I'm part of the all program, and he's in there as a teacher.
Part of season 2, because we really want to talk to the coaches first. And I know he's not a coach, he's a psychiatrist, but he would be great to speak to. Yeah,
he's amazing. Yeah. I love that you're in the awe program. I've heard good things.
Yeah, it is wonderful. Yeah.
Good.
And intense.
Yeah, very intensive.
Yeah.
So yeah, there's, certain flags that we train people to look out for, such as schizophrenia, psychosis, bipolar disorder, heart problems, recent surgeries. There's, medications. I think medications are the biggest one. Ben teaches
seems
about.
Like a minefield if you're not a psychiatrist to understand or even be confident about how do you call it? Cross influence or cross impact?
The contraindications.
Contraindications, yeah.
Yeah. So that it's very nuanced because there's so many different types of psychiatric drugs. And so, really training people about which ones are appropriate to potentially combine with microdosing, which ones are higher risk, when to tell a client, that's I would say that's more of high risk than educating the client around psychedelics, is like being very careful to not tell someone to get off of their medications. That's really a tricky intersection, and I work within that intersection, but it's important for people to know that they shouldn't microdose when they're on 5 or 6 medications. Even a couple medications is very high risk to start to work with microdosing. So I always recommend that people talk to their doctor. And most doctors are open, at least to hearing the patient. It's a delicate intersection because a lot of doctors might not be supportive of individuals microdosing, but it's always helpful to at least to have the support of your doctor. You don't need the doctor to know necessarily if you decide to microdose down the line, but if you're trying to come off of psychiatric drugs, it's so important for an individual to work with their doctor to wean off of them 100%. I think it's important for people to have that support of their team, and that's really what we train about. And so, I would say those are, pregnant mothers, breastfeeding. There's a study that recently has been going on with breastfeeding mothers, but individuals that are going through like acute grief are not suitable for microdosing. It's not, necessarily a good time for someone that would potentially be screened out. So those are some of the areas.
Sorry, I got stuck on imagining what grief would look like if it were cute.
Like someone that just lost a partner.
I misheard, and cuteness and grief didn't quite compute at first.
Oh, cute, not acute.
Acute grief, and I'm like, Anyway, yeah, cool. Screening, Julia. I've heard quite a lot. Do you want to take that further?
Just one more question, because sometimes I feel like when you have a form that people can fill in, some people are not really honest about it. And if you have something, or if you teach something about how to take this intake interview and to ask the right questions to go around that, and to maybe, have a little more information than you would only get with the plain answers that you find on the form. Because sometimes that's my experience for retreats, that sometimes people are or not aware of that they should mention it, or that they know that they wouldn't be taken on the retreat program, whatever, a coaching, if they are honest about it. So is there something that you teach also your coaches or your upcoming trainers, facilitators, how they can go around that and be more aware of it?
Absolutely. We have a whole session on the intake process and hundreds of different questions that they can ask people. And we do live examples of what an intake session would look like and areas to look out for. And, ultimately, if people don't want to be honest with that process, it's hard to ever know without doing like a drug test with people. So yeah, I think that's a tricky area for sure. And definitely with people with addiction, they feel hesitant about, being honest in certain areas. So it's definitely a flag to look out for practitioners.
Yeah, so you're also putting a lot of trust in your clients in a way, because it is a relationship, right? You do work with them, and in a way you're entangled in their well-being now. And if something were to happen to my clients, that affects me. And so that invitation of trust really needs to go both ways.
Absolutely.
But again, there's this, maybe it's my existential lens, that responsibility keeps popping up, right? It feels quite responsible to do this kind of work. And I think when the stakes are high, and again, with high doses, the stakes are, I think, a lot higher than with microdosing. But it's a very special relationship when you work with somebody around these substances.
It is. And ultimately teaching them that the less authentic they are, the more harm they can experience. And so, there's a lot of benefit for them to be able to receive the more honest that they are, because ultimately they're being honest with themselves.
Mm-hmm. I'm much more interested in the space beyond healing, fixing addiction, drugs, getting off meds. Much more interested in the growth, well-being, transcendence, moving things forward, learning kind of space. So when people want to microdose around there, you say that some of the protocols really depend on what you want to do. Is there something you recommend? Is it always tailored to the person who's coming in? How else can microdosing help clients who come to coaching, or might a coach introduce this? In what context might they introduce this? So I know there's a bunch of questions in there, but I'd love you to talk a little bit more about that moving forward for relatively resourced people space.
Yeah, I think, how does Jim Fadiman say it? That microdosing helps people be better. And it's, what we're hypothesizing is that microdosing creates neurogenesis and neuroplasticity, which is the ability to grow new neurons and have new beliefs and new neural pathways in the brain. And what the research shows on neuroplasticity is that neuroplasticity in and of itself is inherently neutral. So it can be positively influenced or negatively influenced, which is so exciting because we are a participant in that process. And we have the ability to change our brains in partnership with microdosing, and that neuroplasticity can be applied to anything. And, especially for people that aren't moving through a deep process or, are healthy, microdosing can be like riding an electric bike. We still have to be the ones to be the participant and pedal, but it can help you get to where you want to go with greater ease and acceleration. And that can be anything. People come to microdosing just to improve their overall well-being or their feeling of wellness within their lives and within their consciousness. Maybe it's learning a new sport or learning something new or developing a new habit or breaking a habit. Maybe it's creativity or endurance, and maybe it's just wanting to accelerate in your career or reach new goals. I think microdosing can help us reach our goals with more acceleration.
So there's a process around protocol, how much to take, when, what the kind of schedule is. And then how does the coaching process work with that? Is that around facilitating? I mean, it's more than facilitating the process of the transactional, right? How do I take this? When, what? For example, does it matter what does the coaching sessions need to sync with the particular schedule? Is it important? Are the coaching session on off days and on days? Does it not matter? Can you tell us a bit more about the kind of process, the journey behind those?
Absolutely. So the first session is the intake session, the screening session. Generally, people will fill out the intake form prior to that session, and the coach will go through the intake on that session and ask them deeper questions about the intake. And then after that first session, then they have the education session. Well, if someone's brand new to microdosing, they'll educate them all about microdosing in a 1-hour session, introduce them to the different substances, the protocols, best practices, the risks, the benefits, and then decide on their substance that they're going to use and the potential first protocol that they will use. Then the person will start their dose. Sometimes with a practitioner, the next session will be to decide on the protocol and the dose. Just kind of depends on the situation and what the client is navigating. We train people to do a day 1, week 1, and month 1 check-in. So after the client takes the first dose, they check in with their coach, how it went. We have a whole framework for a tracking system for the participant to track their process and their progress, all different types of questions to be able to check in with themselves and really start to develop that relationship with the medicine. And then they check in after the first week, they check in after the first month. If people are going through more of an deeper issue, they might want to meet more frequently with their coach, and it's really up to the coach to decide that. But that's the framework: is the intake, the consultation, the education, then day 1, week 1, month 1. We call them look back sessions. So you're looking back to see how the microdose went for you.
Cool. Can you tell us a story about someone who's kind of gone through this? Maybe somebody who was memorable, or somebody who kind of encapsulates that I want to develop further, I want to have insights, might have a particular goal, maybe they felt stuck with something, but somebody in that, what I might call the coaching range, right? The non-clinical spectrum.
Yeah. I worked with a lawyer who's very successful, healthy, and just was curious about microdosing for themselves. And it was very helpful. They realized that they had been having looping thoughts that they weren't aware of. Even my dad just microdosed for the first time. He's totally healthy. He's a doctor. He's a cancer doctor. He just microdosed for exploring and, heard me talk so much about it. And he too noticed, he was like, wow, I have looping thoughts. And he noticed that on the microdose, he didn't have the looping thoughts, that he was just able to be present with himself. And he recognized that he had this like undercurrent of fear and worry and always thinking about the future, thinking about the past. And the microdosing just really helped him be present with himself and with the moment. And that's what I heard from that other client as well, of just becoming more conscious and aware of the unconscious sort of undercurrent of their overall reality and having spaciousness from that. And I think that's so beautiful. Another client came to microdosing. They were doing great, feeling well in their lives, just curious to explore it. And they realized that they were depressed because they felt so much better from the microdose. And they had no idea that they were depressed until they microdosed and felt...
I've gotten used to it.
Right. Exactly. So those are just some examples.
Yeah. what if nothing happens? And I know partly there was already an answer earlier in terms of, well, sometimes that's what the medicine is trying to communicate. But I'm also asking for somewhat personal reasons, right? Because I've experimented with microdosing a couple of different times, and I've never really noticed any discernible difference, right? And I wonder, does it affect different people in different ways? Is there something about me particularly in terms of how that connects? Was it not a right time in my life? And I'm sure you've had many participants or many clients who kind of went on a schedule and then nothing shifted. Perhaps I wonder what some of those reasons might be, or what I've done wrong.
Well, the first thing to know that you didn't do anything wrong, and there's so many different factors to the microdosing. So one factor is the medicine. There's hundreds of different strains of microdosing. And what the research is showing with Hyphae Labs is once the mushrooms are ground up and homogenized, they lose their potency by about 50% within the first month. So sometimes people can be taking mushrooms that they don't know are really old. After a year, they lose their effect. So that sometimes can be a factor. Other times it has to do with the dose that you're taking is just not strong enough, and you might need to increase the dose. We've been trained to believe that you're supposed to feel it because you want to know that it's there. I think sometimes people are wanting this big experience. I've had people come to me and say, I don't feel the microdosing. And then we kind of go more deeper into conversation. And I asked them, well, what was your relationship with yourself that day? And they said, I wasn't mean to myself today. I was like kind. And that can be a subtle shift of just, wow, I was less self-critical, or maybe there was just a subtle awareness. And so understanding the nuance of microdosing can be important. And I think you're supposed to feel it to know it's working. So trying to adjust the dosage, adjust the strain, adjust the medicine. If none of that works, then it could be a situation where the microdosing is just saying right now is not the right time. It could be mental factors, environment, safety within the medicine that person feels. So those are just some, examples of things to look at when adjusting the dosing.
It really goes to show also the value of coaching, right? Because I didn't work with a coach at the time around those experiences. I just did that by myself. But if I had someone there who would have been all sorts of curious about my experience and, invite me to reflect on things that I probably didn't reflect on at the time. I think I'm reasonably self-aware, but I'm sure there's things that I didn't pay attention to. And I think that's just the wonderful thing about having a coach in your life, who just invites you to reflect on things that maybe you wouldn't have considered.
I love that. Exactly. Seeing the value in the coaching that it can have in this process.
Mm-hmm. And a coach knowing what to pay attention to. And I guess that speaks for microdosing training for coaches who want to work with clients who are microdosing. How facilitative or directive that might be. But it does give you a set of things to be curious about. What was your relationship with yourself yesterday, for example, in those kind of look back sessions? Just some of that terminology, some of those questions and how they're being formulated. I think it's just such a valuable thing to have in your backpack.
Thank you.
And also to know that the different substances work differently for different people. That's also, I personally tried also different, like psilocybin and LSD, and they are so different for me. Like the one is working very well and the other one is not working for me in microdosing.
What was your experience?
With the psilocybin, it really worked for me. So it really helped me being more grounded, and also there is this threshold when I really feel it, and then I know it's too much. Not that I can't work anymore, but it's just I'm getting tired at one point of the day. And if it's the right amount, then I have more of an energy boost. And I feel myself in a different way. So it helped me for a while in a certain time of my life to get really in contact with me again and with my body again. So that was very helpful. And with LSD, it was more a feeling of there was just too much. I had too much energy in my body, and I was just too many thoughts there, and I wasn't calm in myself. And so for me, the microdosing with the psilocybin worked way better and helped way better.
That makes a
So I
lot of
guess
sense.
there's another argument for helping people to develop a relationship with themselves or with the medicine or with their experience of, with their way of experiencing what is going on for them, regardless of your spiritual perspective or material perspective on psychedelics and what they do and who they are. And are you inviting a different consciousness into yours, or is this something that acts on your receptors in your brain in a particular way? Whatever that is, helping someone to listen to themselves more and deeper, and getting into a dialogue with yourself, whether you experience that as a voice that's answering you or as a sensation that's coming from your body, which tells you to adjust this, that, or the other. That's just tremendous value, regardless of how that person is relating to psychedelics or the medicine. Uh, so I think that's really helpful to understand the bandwidth of how people might relate to what they call a medicine, or they might call it a drug, or they might call it a substance. Like, um, so I'm always quite curious to just kind of sit down with someone, and part of me is like, oh, I'm giving away so much about how I relate to these things. If somebody were to listen to that all and then come talk to me, it would possibly be a different conversation to when I just get referred by someone. Oh, you should talk to Yannick. They know nothing about me. I often prefer that. You know, there isn't that kind of existing relationship and trust and credibility, but I get to experience them with a really blank slate, and then they're not influenced by what they think I'm thinking, or what they know I'm thinking. Um, they're just really coming in, and I get to sit with them. And like, for example, I'm not religious, and I coached someone who was incredibly religious, and it was a wonderful piece of work, even though at some point it kind of got revealed where we both stand in this. But would they have shared this so openly with me if they knew that I didn't believe in their God? And I always wonder about that in the psychedelic space. It seems to me that clients seek coaches who already agree with them on how they relate to psychedelics, and they choose their coach for that reason. And I don't see so many coaches who would work with anyone regardless of how they relate to this. Um, Curious what you think about that, Anya.
What do you mean by how they would relate to this?
Yeah, so for example, some people they go meet the aliens, or they ask mother for advice. They go to seek the wisdom of the mushroom. They talk about downloads, and others go and want their own mind to be revealed to themselves. They wanna look into the mirror without clouds and smoke, but they understand, like, for them the relationship is, this is my mind. All of this is in my mind. There is no external influence here. There is no deity, substance, or ancient wisdom that is I'm in a relationship with. I'm just in relationship with myself, and my mind is being revealed to me. Those are kind of two ends of, like, maybe not of a spectrum, but like two very different perspectives, very different ways of relating to psychedelics. And it seems that they seem to be somewhat in silos. That somebody who has a materialistic perspective would go to see a coach who would already have that perspective, and they might not want to talk to somebody who has a more spiritual perspective on it.
Mm-hmm. That makes sense. Yeah. I can see that preference being important to someone. And also just leaving room for magic and mysticism to emerge. Like, I know for my father, he's very scientific, didn't believe in magic, and now he believes in mystic mystical experiences and magic, and he's really opened up to that. And when he talks to me, he kind of opens up a little bit to more of like a spiritual perspective. So, but I think, yeah, it's totally, I think just, I appreciate you speaking to sort of the nuance and the styles and how that can be helpful for people when relating to their psychedelic experiences.
Do you think it's important to be matched in terms of how you relate to psychedelics?
That's a really good question. I think it's important for the coach to attune to their client without putting their own, like, just to, I guess, you know, I come from a very spiritual perspective, and someone might come to me with more of a materialistic, less spiritual perspective without knowing that they were actually spiritual. And so me sharing my spiritual perspective on things I've seen has actually allowed people to open up spiritually that felt spiritually shut down. Whereas if I met someone that was spiritually shut down and met them with an energy of being spiritually shut down, they might not have been able to open up spiritually because they didn't have that catalyst to growth and change. So I think it's important to meet someone where they're at, while also for the practitioner just to be authentic with who they are. And maybe with the client, they're never going to open up spiritually or feel like they can feel, a resonance with that. And for them to feel honest and comfortable with that's not resonating. While I think in other areas, it could potentially, certain styles could open people up in ways that they didn't even know that they were resonant with.
Julia, what do you think?
I have an eye on the time.
Oh, yeah.
And I was realizing we were very good in covering nearly all our quickfire questions in the meantime, in the interview already. But I have one question regarding what inspired, influenced you in your work, in your life, because you talked about your spiritual background, you're connected to indigenous tribes and backgrounds, and what was most influencing for the work that you are doing today? Maybe like persons or books or tribes or cultures. So what is that in your opinion or way?
I feel like the psychedelic medicine has been the most influential. It's ayahuasca specifically has been one of my greatest teachers. She's been more effective than any coach, facilitator, practitioner that I've ever worked with. She's just, the spirit of her has been so impactful and helpful, as well as microdosing, psilocybin, and LSD. These molecules are just such powerful teachers and influential teachers to me. And I'm so grateful for them, for the medicines and how much they've helped guide me in my life. And I feel like the work that I do is in reciprocity to the medicine for how much it has helped me and continues to help me. Most of the work that I've done personally with ayahuasca has been with the Yawanawa and the Hunikuin tribes, and really appreciate their cultures. I appreciate how empowering they are to individuals in those ceremonies, how they teach you to be the one, to take care of yourself, that it's about you healing yourself. And that ceremony is a school of life. And, you're showing up to class to learn as a humble student of these medicines. And I love that. I love to come to this work with just a beginner's mindset and, and being just open to learning and really bringing my humility to these sacred plants and these molecules for the power that they hold and the immense transformative energies that they are and the ways that they work with us and connect the world. And I always say that, like, the medicines are on the board of our organization. They're really the ones in charge. They're guiding this whole process, and we're just working alongside them. I'm also really grateful for my mentor, Dr. Jim Fadiman. He's an incredible teacher. He's really a pioneer in this work, and I appreciate him. We wouldn't be here today with this microdosing program had he not paved the pathway forward for all of us for decades, and him really putting himself out there and educating people around microdosing. Millions of people worldwide have been impacted by him and his work, and I just adore him so much.
Do you have a favorite piece of writing of Jim?
I love
favorite
his book
or favorite article?
Yeah, the Psychedelic Explorer's Guide.
Yeah, I figured you might
new
say
book.
that. Such a good resource.
It is. And his new book is about to come out in February. It's on microdosing.
Excellent. Do you know what it's called?
Microdosing for Health, Healing, and Enhanced Endurance.
Oh, very cool. I'm currently listening to Symphony of Selves.
Amazing.
Which I love that he went into the kind of multiplicity space. It's been so helpful, and especially in psychedelic work, so helpful to create that dialogue within yourself that we talked about. So yeah, very cool. What do you think about regulation? I wonder. I mean, there's a lot of cowboys and girls out there in the coaching space that often with best intentions do put people at risk, right? Because they don't know enough, or they don't know themselves enough, or they jumped into this too early, or with not appropriate training or knowledge, whatever it might be, right? So often regulation is established to ideally keep people safe, clients safe. But then also regulation often leads to keeping good people out of professions, and there's arguably very little regulation in coaching, and especially not in the psychedelic space. There's some legal regulation, but as we already talked about, there's ways around it in some way. But like, do we need more regulation? Do we need to stop regulation? Or what's your take on regulation?
I think that self-regulation and community regulation through education is the best form of regulation, because I always get curious. It's like, well, who is the regulating body, and who's doing the regulating work, and why are they the regulators? But I think we can regulate our communities based on teaching people best practices. And that's a big part of the work I've done with my nonprofit organization, the San Francisco Psychedelic Society. I would teach classes about what to look out for in a facilitator. What are some red flags to look out for, to teach vulnerable people to know what makes a good facilitator, what makes a not good facilitator, and really empowering people to interview the people that they're working with, and that they have choice and sovereignty. So I think education as a form of community regulation is important. It's a difficult place, because I think within regulation comes more control. But there's also, without regulation, there's less of community support and accountability. So, there's a lot of harm that's happened within the psychedelic community. And, there's not like a regulating body to hold people specifically accountable beyond the community itself, holding people accountable. So we're really focused on that as a community, is like, how can we hold our communities together? Because, yeah, I think the support of the community is incredibly powerful.
Mm-hmm. Just briefly, Yuli, before they ask the next question, is there a resource that you could point coaches at around the kind of questions? I mean, coaches, clients at the kind of questions. If anybody's listening to this and they're wondering, they would like to work with a coach, have you ever written this up, or is any of these seminars recorded in terms of the kind of questions you should ask a facilitator? Because I think that's such a valuable resource.
I don't have a recording, but I could definitely write, an article about it. I think that would be a great resource. I know a friend of mine has also written an article about this. I wouldn't be able to find that off the top of my head right now. But, some questions to ask is like, what is someone's experience? If there's anyone that person can talk to that's worked with that person, how many people have they worked with? What is their particular style or motivation? Have they been vetted by a particular person? There's all different things that I teach about. Does that especially when it comes to psychedelics, are they doing warrior retreats where they're offering 5 or 6 different medicines all in one setting? What type of preparation do they offer? What type of education do they offer? What kind of education to integration do they provide? So many different questions, to really empower people to ask, I think is so important.
Mm-hmm. Yeah, thank you.
One of our last questions is if you could take over a screen of any person or group of people for 1 minute and you have undivided attention, what would you let them know, or what do you want to tell them?
What was the first part of the question? I'm sorry, I didn't catch that.
So if you can take over a screen of any person or group of people for 1 minute, what would you tell them?
Or you can transmit yourself into their brains for those people who don't have screens. Just if you could capture the attention of someone or a group of people, the whole world, or maybe just a particular politician, what would your message be?
I feel like I come here to spread love and awareness, and just to empower people that they're so powerful, and not in like a dominating way, but just in a empowering way, and just reminding people that they have the power to be anyone that they want in this lifetime and to create anything that they want here. We are magic just by being here. And there's a lot of power and inspiration in sharing our stories with each other. And, we all are teachers to each other. We all carry innate wisdom. And I want to empower people with that, and that they have the opportunity to impact a lot of lives, and that the impact is a fractal, and it's infinite, and what we can and how we can inspire each other. And it starts with you. It starts with me. And I just want people to know how amazing they are just by existing.
Cool.
Thank you.
Well, that's a message that everybody should hear for sure. Hey, Danielle, thank you so much. Where can people step into your sphere? You mentioned Flow State. You mentioned a few other spaces where people could get in touch. If they want to learn from you, maybe work with you, take one of your courses, where would you send them?
They can find me at flowstatenow.com. I'm also my organization, San Francisco Psychedelic Society, psychedelicrecovery.org. I'm on Instagram at Connect with D. I'm also on LinkedIn, Danielle Nova. And I look forward to connecting with anyone and welcoming them into my world. And, just want to I love collaborating with people, and I'm really grateful for the opportunity to come on your show today. Thank you both so much for your work in the world. And very grateful and honored to be here.
Thank you for being with us.
Yeah, time, such a valuable resource, as we already established, right? So it's the greatest honor that you give us 2 hours of yours. And yes, really appreciate your work in the world and how many doors you've opened, not just for people, but also for the profession and the movement and the medicines. So thank you.
Thank you.